So we're going to do some shoulder mobes. One of the techniques, or not techniques, but one of the basic principles when you're doing manual techniques, you want to hug them, touch them, squeeze them. You want as much contact as you can get, comfortably get, appropriately get. So on the arm, and when you're working the shoulder, you want that, them to be able to really relax. So I've got you like right up against me here. All right. So I'm going to come proximal to the joint and just kind of start feeling. So, I'm on the joint, or I'm on the head of the humerus, right? And so I'm checking here to see how much flexion or scaption can I do before the shoulder blade starts moving. And him, his shoulder's moving real well. A lot of times you're gonna get patients right in here and they start hiking. So that's as high as you're gonna go, and then you're gonna do some distraction. And I got my arm against me here, right? And I'm pushing the inferior. I'm using my body, not my arm, to mobilize. And so you can do, little ones. Again, I've got some pressure here, but I'm not digging in on the elbow, right? Really, it's just about holding you against me. And then I'll check, move up a little bit, do some more. Then after I've gotten him up high, I'll usually just now we've got good. So he's relaxed, and I'm coming up and relax here. So I just did inferior. I'll do some posterior mobes in a minute. But here I've just kind of telling them to stay loose. I'm doing circles. I'm always doing up and out circles with the shoulder because everybody's already stuck down and in. Let's take them up and out. I'm going to hold pressure here, make sure he's not hiking the shoulder up. And I want you to give me a push. Push me. Good. And push. And I'm doing this right here to get a little tactile, help him push me. So this is just kind of a contract, relax to help with flexion and relax. And push again, push, 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 and relax. And push, 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 and relax. Good. No problems there?
No.
So here we are. Now, I'm really proximal. I'm right on the head of the humerus, and this is posterior mobes. Distract, push, posterior, relax. It ends up, you can imagine the head of the humerus doing little circles. Okay, let's turn you to your right side. We're going to do scapulo-thoracic mobilization. Anything in my pockets I'm taking out because I'm going to be right on you. Let's have your arm to the side. Just let it rest right there. So I'm on it. I'm going to use this hand to get the top right corner of the medial border here of the scapula. And on the left shoulder, I'm always doing clockwise mobilization circles. And when I come down, I'm trying to isolate, and again, I'm spreading out the pressure. So I'm doing a little levator scap stretch. Each time I do a circle is a little stretch. And I may hold it, for a little prolonged time, or I might just do circles. These fingers here, I'm just kind of feeling for, if he's got any big time crepitus going on in the AC joint up here, I may do more, I may do less, just depending, is that painful at all? No. Keep going. But I'm locked in here.
How much of your body weight, more or less, are you kind of leaning a little bit?
Here I'd say 20.
Okay.
20%.